All right, good afternoon, everyone. Thanks for joining us. I think I went a little bit long last time, and fortunately, I ostensibly have a succinct agenda today. I shouldn't overpromise that because that usually leads to problems. Cool. I see the note takers are talking to me in chat. Perfect. That's how we know it's time to get started. So thank you all for being here and giving us a little bit of your time this afternoon. Just going to run through our usual. Welcome to anybody who is new here today. I see definitely some old friends that I haven't seen in a while, but thank you all for being here. Wanted to just give some kudos this month. One to Tim Kleinsorge. I don't know if he's on today. I got a slightly different view of the participants, but he organized an excellent pediatric day and involved us as part of that. So that is super convenient for me. I'm just going to go ahead and say that selfishly. If you want to organize a multi-county area and get a bunch of providers together, we are glad to try and get an educator there to cover any of the special needs topics that you want. So it was an excellent day. Also, if you feel free to go to your local mom and pop Italian restaurant and serve us homemade lasagna as well. I'm just going to go and throw all of that out there quite selfishly. So, but no, that was a great day. And then shout out to our friends at SCAD who organized one of their holiday events and had a bunch of the kiddos come through a drive-through line. And my team did convince me to participate as well. I was not allowed to wear my Dallas Cowboys jersey this year as part of Halloween. So we were able to get dressed up from that. It's always fun to meet the kids when they come in costumes as well. And so just always kind of giving out there for ideas for agencies to get engaged with their kiddos in future years. Just please take whatever you like from these ideas, adapt them to your area. But it really is a phenomenal way to meet your families and your kiddos in your community. Certainly encourage that. I just have one call review for us here this month. This was early October. This was a flight for a well-known STARS patient in Southeast Missouri who you can see EMS was called and then activated the flight crew. This is the flight crew's trip sheet. And so they were called for a kiddo coughing up blood yesterday and today and then was requesting a flight up to Glennon. So I did include this kiddo's stars information. As you can see, he has an extensive history. Unfortunately, he's one of those kiddos who, had heart problems that over long-term right-sided heart failure has led to a lot of distension of the vasculature, and so a lot of complications from that out to the right side, out to the liver, back to the lungs, and so continue to just have lots of varices problems and bleeding. Um, and so, as far as anticipated emergencies, he is a chronic long-term heart kiddo and trach vent dependent with respiratory failure. So he's a kiddo who, despite being a teenager, has continued to have low sats as his baseline, and then a history of the hematemesis. And just I wanted to give an example of a note. I know some of you have seen this from previous meetings, but in case it's new to you, we have started to add for patients, especially our cardiology patients or patients whose their specialists have given us permission. We are starting to give EMS permission to call the access line as well. If you're going to be transporting to us, if you need further guidance, either for a safe refusal or for more detailed treatment if you need it. But that's going to be an option in there for some of the kiddos with just instructions of how to use that or activate that. Um, Back to this kiddo. We already got the hematemesis. He's had brownish black sputum with that history of esophageal varices. The main reason of note that I wanted to call attention to this is you guys continue to astound and impress me from the field. Kind of maybe a more ultra rare, unless you listen to Scott Weingart podcast, but they called for orders from Glennon to nebulize TXA and administer that to this patient because of the upper airway bleeds. So that was, I thought, pretty next level. They did complete the treatment and transported the kiddo all the way up to us. It was over an hour-long flight, so um, uh, even for this area, obviously that's a little bit longer of a flight time. But just I thought kind of impressive next level care. And I just wanted to briefly mention that that is not a new thing. As always, these things with TXA, well, a drug that's been around since the 60s. Um, it's just not a commonly thought of way to use it. But I don't know if Dr. Laffey made it on here or not yet. But he was also looking at some other situations I know that you would consider using nebulized TXA. And one of the other possibilities is kiddos who have post-surgical bleeding in their airways, especially after TNAs and stuff like that. So I just, I learn something new each and every month, and I just thought I'd call attention to it. I thought it was something a lot of us could learn from. So I thought that was a pretty cool treatment and call. So just wanted to share that with everybody. Were there any questions about that one?
I'm guessing it worked pretty well.
It seemed to have worked. Yeah, they didn't notice any further problems. Vital signs, I didn't include the whole serial, but vital signs remained stable throughout the call, and they did not have to suction or note any further bleeding. So it certainly didn't make it worse, and hopefully some benefit to the patient. So. Cool. I did just switching gears, want to mention the EMS surveys. I know I've talked about this a few times, but we'll just go ahead and say we're a little bit on the struggle bus for getting returns to us for EMS post-call surveys. I am aware, I know after running a call and already having to fill out your trip sheet, sometimes the last thing you want to do is click a few further boxes. We did very intentionally try to limit it down to the bare minimum necessary of what we kind of needed for post-call surveys, but it would really help us if crews would be open to completing that survey. I know they're up in the children's EMS rooms here, and then we put it in multiple places on the site. So please don't be surprised also if we reach out to either the coordinators or your crews directly and say, hey, we saw you had a call last week, last month, whatever the story is. Would you guys please complete this survey? It just is helping us understand, first of all, like if it reiterates, yeah, the system worked well, perfect. Do we need to hear that story too, or if we hear different ways we can improve it? But it would really help us to hear that back from the calls. And also, it is built in there as far as if your clinicians want a direct survey or a direct feedback from us regarding the call, or to know what the ED course was, the PICU course was. It's just an easy way to request follow up. So we just want to make sure that you all are aware of that, and through you, your crew members as well. So just wanted to reiterate that one. The other thing I just wanted to share with everyone as far as, kind of sharing available resources, this link goes to a number of courses. I just gave a screen cap here for examples, but there are about 60 courses up on the PPN Learn LMS, which of course is a grant that we're part of. And, I hadn't been on there for a while, and I was recently on there earlier this month, and they really have added a phenomenal number of resources. So if there's any education on there that's of interest to your agencies, to your hospitals, I will also say, especially for my agencies and hospitals where you have your own LMS, one of the things that they permit and allow is you can apply for and download the training modules as SCORM courses and upload them into your own LMS. So if you have some training you need for disaster month or pediatric respiratory month or anything like that, they're just some nationally available free resources. So I just wanted to make sure everybody was aware of those. They are a little bit disaster focused. That's the nature of PPN. But there are even just some plain clinical topics in there as well. And I will say that we helped through the Missouri MSC, and Danny Lee, if she's on here, created 3 courses for EMS, home health nursing, and family members of children with medical complexity. So just another resource. That one, I don't know so much as it currently stands. It's a okay resource for your providers, but where it'd be really useful is as far as connecting with your families, especially if you see a family who has some questions for you in a home visit or in station visit. An easy way to give them some quick resources for emergency preparedness issues. So just wanted to make sure everybody was aware of that. I tell you what, I'll copy into the chat notes that link as well. Cool. So our numbers for October. So there's the map. Continued a little bit of expansion. Added a net gain of 13 new plans and kiddos for last month or since our last meeting. And for my logins, my dispatch agencies are dominating. So kudos to you guys, and thank you very much for that. And then for dispatches, we did have set a record for last October, or for all time for all months this past October. So we had 66 dispatches. I don't know if we're going to catch that here in November or not, but we are up to 34 already in November. Just for any of my dispatch agencies on the call, I was just going to kind of quality check in and just make sure that it's pretty clear from the families or our families leading with their stars number. And I only ask because we've done a lot of work recently in trying to connect with families and remind them of how to use the system appropriately. So I didn't know if anybody had any anecdotal evidence to support or negate that. Patty, I see you are unmuted, but I am having a hard time hearing you if you're talking to me. Fortunately, I cannot hear you. It is very background. So, any of my other dispatchers?
This is Kim with Central County. I'm not
Okay.
actually on the floor taking the calls any longer, but I
Hi,
haven't had any negative feedback as far as them not giving that information right off the bat.
Okay.
But I can put out feelers and give you more of an idea the next meeting.
Yeah, if you don't mind checking, or even just,
Okay.
as long as people are a little sensitive to, like, please let us know. Just it is very important for the families to lead with that. So I just wanted to make sure some of our messaging was getting out there to them. So
Okay.
cool. Thank you, Kim.
You're welcome.
As far as access reasons, I forgot to update the month. This is for October. We actually did see a flip from emergency treatment to education and training. So, absolutely, please, more and more agencies, I encourage you to get in and use it. Awesome. Sorry, Patty, I'm just reading your message. Okay, perfect. Seeing definitely an uptick in people accessing for education and training, and highly encouraged. So please, please, please keep that up. I can't wait till the day where that dominates emergency treatment. I'd rather you guys just know about them and not have to treat. So, as far as 911 transport calls that we are aware of by months, we had 41 for October. You can see 10 non-transport calls. A slight slip in stars references in the EMS trip sheets, so just trying to get that in there as much as possible. September maybe was just an excellent month. And then direct to tertiary continuing to hang out in the 90 percentile. So that seems like a very reasonable long-term sustained goal. So and then we actually saw a drop in the time to MD care plan approval. It went from, I think it was somewhere around 4.6 last month to 3 days this time around. So always, I think, a positive thing whenever we can accelerate that number. As far as education requests, this continues to be the way to request training from STARS. So please feel free to pop in there and fill out the form and just say you need STARS training, or if you more specifically, trach training, seizure training, whatever it is. And we will be happy to respond to that. We are probably not going to get out as much here in December, but we are scheduling into January and February. Just have some end of year stuff to wrap up here internally in the team. So. On that note, this is our last meeting for 2025. So I can't believe it is already done and gone. Nearly, but almost to Thanksgiving already. And so as far as we had put out a survey for meeting times for next year, and Tuesday came back with the lead. We probably have a lean towards Tuesday afternoon. So Unless there are riots in the streets here in this meeting, we plan on, we'll cancel the December meeting, but come out with a meeting series for Tuesdays for next year, probably second Tuesday of the month. So I hope we have a good-looking group of people on here today. I hope everybody that time will work for them moving forward. And that brings us to open session. So are there any open questions, comments, or concerns for me?
I just want to say that we received the stars sticker for the door, for the houses, and greatly appreciated. I think that's a good resource to have for stars families.
Awesome.
So
Cool.
appreciate it.
Yeah, you're welcome, man. Well, as long as nobody's going to get too upset, I'm going to wrap this meeting a little bit early here today. I will hang on for anybody who wants to chat or just talk in a smaller group. But I'll go ahead and end the recording and wish everybody who needs to leave a happy day.
Thank you, sir.
Thanks, Matt.
Thanks,
Thank